My name is Valerie Jimenez, and I'm a program at Women's Center. I use she and they pronouns, and today I'll be facilitating this event on finding hope in crisis. And what that means, really, kind of the central point of the event is mutual aid. I'll be talking about what mutual aid is, and kind of how it functions, and also how it can aid in creating stronger communities. So in systems of mutual aid, communities take on the responsibility for caring for one another rather than forcing individuals to fend for themselves. So what this really means is that mutual aid is not charity. I think it's really crucial to understand. The way that charities function, is that all of the resources are kind of localized to one resource, and people still have to kind of have this top-down relationship in order to have access to that. And really what mutual aid is attempting to do is create a form of solidarity, not charity, so that we really are creating stronger networks of community. And mutual aid compensates for where infrastructure fails or does not exist. Often, people of color and the most marginalized folks are left behind, and mutual aid really flourishes in those communities because everybody kind of has to protect each other. But the term itself, like mutual aid, was actually coined by Peter Kropotkin, who was a Russian anarcho-communist, and it came up for him in the context of his work as an evolutionary biologist, where he used the term specifically to counter the idea of social Darwinism, which is basically like survival of the fittest. Some quotes from his book is, the species in which peace and mutual support are the rule prosper, while the unsociable species decay. And practicing mutual aid is the surest means for giving each other and to all the greatest safety and the best guarantee of existence. And I include those just because I feel like that really is what it is that we are looking out for each other, therefore also looking out for ourselves. And mutual aid has largely been adopted by leftist movements and groups who are trying to foster a world really centered around community. So I'm going to give a few historical examples just so we can kind of understand how broad mutual aid can exist as, but I want to mention that mutual aid has always existed before 1902 when that term was coined, and it has always existed in indigenous communities and communities of color. So this is not at all an extensive list of what it can look like, but just as a bit of an introduction, here we go. So first off, I want to talk about the Chinese Workers Mutual Aid Association. So this started in the 1930s, which was a very difficult time for the American working class because the economy was still dealing with the ramifications of the Great Depression. So there was an effort put forth by Chinese workers to attack the Alaskan Packers Association, which was like canning salmon. And they wanted to, essentially get like workers' rights, and there was a lot of labor organizing that was going on. And they were really successful. They set up a picket line, and really halted all of the actions that are required of a company to function. And the association capitulated and was like, sure, you can have your little union. And it was actually really great because all of the workers were, of different marginalized identities. So it was a really big win. And as kind of an aftermath of the victory, there was a group of Chinese workers who decided that there should be a more formal association to acknowledge the work that was already being done. And that was when the Chinese Workers Mutual Aid Association was established. And at first it had the aim to unite workers and, exchange experiences and also just help people find work and really create a strong unit of community. But it went on to broaden the scope of its functions, and it actually encouraged Chinese workers to join the trade unions and to recognize the value of working collectively to better the working man's condition. And I use this as an example of mutual aid because this association really filled a need in the community. Almost immediately after it was created, there were 400 to 500 members already on its membership rolls. So there was really a need for this to exist and for there to be a sense of community here. And kind of moving on now, a little bit later in history, is the Black Panther Party. And this is, I think, a pretty staple example. A lot of people learn about this in college courses, I feel. So the Black Panther Party started a breakfast program in 1969. And basically how it worked is that party members and volunteers went to local grocery stores to solicit donations, and they consulted with nutritionists, you know, to make sure that they really knew how to create healthy breakfast options for children. And then they prepared the food and gave it out free of charge. And it was extremely, extremely successful. It fed tens of thousands of hungry kids, and it helped contribute to the existence of federal free breakfast programs today. I think it's really important to include how positive of an impact this had on the children who were a part of it. You know, they immediately started performing better in school, and it just had such an overall benefit in their lives. And the Black Panthers did a lot of mutual aid work, and some that kind of relate to health crises that I think are relevant to kind of the moment we're living in right now is they also organized the People's Free Ambulance Service, which is exactly what it sounds like. It was free ambulance service for folks who otherwise wouldn't be able to afford that. And they also opened health clinics where people could be tested for sickle cell disease. So there was a huge effort being made to fill the gap in these disparities. And here are some photos of the kids eating their breakfasts before school. And not long after, there was the Young Lords Party. So the Young Lords were a radical group of Puerto Ricans modeled after the Black Panther Party, and they were really, really rooting and fighting for Puerto Rico's independence. And in 1970, on November 10th, they took direct action against this hospital, Lincoln Hospital in South Bronx, which was the only hospital in the area. And it was extremely incompetent, and it had several health violations. And locally, it was known as the butcher shop because there were so many people who would die there because of these violations. So they took over the hospital, and while they were there, they conducted lead and TB detection tests, which was really important because at this time in the South Bronx, there was a lot of lead in the paint, and there were a lot of children and, well, all people really, who were testing positive for lead poisoning. But the hospital was not instituting tests, again, because they were really negligent. So the Young Lords saw the need in the community for all of these things. The hospital wasn't doing it, so they took it into their own hands. And it actually led to permanent change because the People's Program, which was a rehabilitation program for addicts and alcoholics, actually ended up being a official and permanent part of the hospital. And this was really important because there was a huge heroin addiction problem in the South Bronx at this time, but there was no work being done to help. So the Young Lords saw a need for better healthcare in their community and addressed the issue head on. And they organized other actions that centered community needs, such as like a system for garbage pickup because there was so much litter around the streets because the city was like negligent. And so they did a lot of work revolving around taking the needs of the community and taking direct action to make sure that they got it. And here are some photos. On the left, there's actually someone holding a poster with the demands that they had for the hospital, which is the whole reason they took it over. And actually, like at the top right, that's actually the day of. As you can see from the flyer, the hospitals belong to the people. And way more recently, there was Common Ground Relief. So Common Ground Relief was established to provide relief for folks who were impacted by Hurricane Katrina. So this was in September 2005. And it had its origins as a community-initiated volunteer organization that offered assistance, mutual aid, and support. And this work gave hope to local communities by working with them, providing for their immediate needs, and really emphasized people working together to rebuild their lives post-Katrina in sustainable ways. So here's some examples of, the work they would do, which were the immediate needs of the people, housing, health, clothing, pro bono work, etc. And they were actually extremely successful within a year of kind of like founding this network. They established 7 health clinics and nearly 100 community garden projects within a year. And kind of going back to health, they really expanded within this year because there was so much that needed to be taken care of. And Common Ground Relief expanded into Common Ground Health Clinic, which had its beginnings when the Veterans for Peace allocated contributions to purchase medical supplies, and then this kind of allowed them to create kind of like mini clinics. And volunteers, would ride around on bicycles asking residents if they needed medical attention. And locals were shocked by this because at the time they had not yet even been approached by representatives of government agencies or the Red Cross to inquire whether or not they needed help. So I think this is a really good example of mutual aid networks coming in and helping where they see a gap in equity. And so with that, here's a picture or several pictures of Common Ground Relief, and also like what Katrina looked like. I know I'm too young to remember that, so I sometimes don't really know how big it was. So before we kind of move into this section, I want to leave a little bit of an opportunity for folks to type in the chat or either turn your microphone on and ask any questions, or if there was something in there that y'all wanted me to elaborate a little bit more on, or you had a comment about. I'll give y'all a few seconds. Okay, so moving on, I want us to talk about what mutual aid looks like in the time of coronavirus, COVID-19. And I think for people who have never even spoken to their neighbors before, the idea of, oops, sorry, just got a text. I think one of y'all, okay, no, it was not a comment. I think for folks who have never even spoken to their neighbors before, the idea of organizing around this can be very overwhelming, which is why I really want to encourage y'all to start very small. So even just beginning to introduce yourself to your neighbors and, voicing your needs and asking if they have any needs that need to be met right now. And you'd be surprised by how effective of a network this could be, because you're so close in physical proximity that connecting with each other and aiding each other becomes something that isn't so much of a difficult thing to accomplish. And something else I want to kind of suggest is starting where you're familiar. Personally, I live in Santa Barbara, Isla Vista right now, and my family's all in Los Angeles, so this doesn't really seem like a feasible option for me. But if you live close by to your friends and family, even just creating a network through them is easy, because you don't kind of have to break the ice to build that relationship. You already have that like founded. And so really what you're just trying to work out and coordinate is how to aid each other through the crisis. But there is also the option of reaching out to a larger community. I mean, I'm pretty sure the reason y'all are here is because you've heard of some sort of mutual aid in your communities, because it's something that's happening a lot and it's making a lot of headlines, and they're popping up on Facebook, Instagram, Twitter. There are Google spreadsheets that are very extensive and comprehensive of people who either need help, folks who are willing to help out, etc. So I really just kind of want to like encourage y'all to start where you can. And I think this kind of leads to what support and aid looks like. And this is kind of something that I don't think can be answered so easily because it can look so many different ways. But I think the most common types of support that I've seen around me are listed here. For example, like doing small services for folks, like running errands for them, picking up prescriptions, etc. Financial support is another one that I see, and it's something that I think can also be done from a long distance, which is, donating directly to low-income folks or folks who've just been laid off and have no source of income, and boosting crowdsourcing links. A lot of people have started making GoFundMes or other forms of crowdfunding efforts. And I think like boosting those or either directly contributing is really a way to help folks out. The difference between that and charity is that, again, with charity, you're not really, there's a lot of kind of bureaucratic systems folks kind of got to go through to actually be able to access funds. And I feel like in a time like this, there's just really no time for that. And on top of that, there's also a lack of actual community there, because it's somebody reaching out to an institution, and it's very top down. And something that I really want to emphasize with mutual aid is that it's about the relationships you build, and it's about cultivating that, and helping someone because you genuinely care about them, and you are building something kind of larger than just reaching out to an institution and saying, hey, you're a charity, I need some help. It's a lot bigger than that. So supply-based, providing food and other essentials and distributing resources to folks. I've seen a lot of this work being done to aid houseless populations, like kind of bags of food and water and other essentials. And lastly, this is kind of beginning to escape the vein of mutual aid and more into like organizing, but I feel that it was still really important to add to the slide is getting involved in housing justice right now. I think everybody is aware of kind of the tensions, the political tensions right now surrounding housing and, rent moratoriums and mortgage moratoriums. So finding community organizations around you that are working for rent suspensions, mortgage forgiveness, and other accommodations for houseless populations and other people who may be impacted by the financial burden and their housing being kind of compromised. So I kind of wanted to include that in there and just put it out there that that's something you can, if you want, you could do. And now I kind of want to open it up because, like I said, this is not an extensive list. What other types of support can we be providing right now to folks? Whether it's something you've seen in your community, whether it's something you see lacking that you think should be happening, y'all can speak up or type in the chat box. Okay, I'm going to move forward then. So while we're speaking about this, I really want us to focus on prioritizing the most vulnerable communities. this pandemic has really exposed how broken our system is. And I think that's something a lot of people have always known. But I think right now, you know, there are a lot of disparities in who's really being the most impacted by this pandemic. Um, and I can name a few, but I'd like to know kind of where y'all are seeing people kind of be hit by this the most, and what we can do to center those communities and really show up for them, and build solidarity. So yeah, so poor Black communities definitely are being hit hard right now. The numbers actually are, it's really sad, the numbers. Poor Black folks are dying at disproportionately high rates, I think more than other populations. Yes, houseless folks, disabled folks. And now, I don't know what y'all are involved in. So I don't know if really, if we're gonna have to like brainstorm this together, but you know, how can we show up for these communities right now? Well, that's a good one, folks dealing with addiction. Yes, incarcerated folks. I think, oh wow, these are like really good. Some that I would have like probably, if I had tried to make a really comprehensive list myself, probably would have failed to include. Yes. So I don't know if y'all know of mutual aid networks that are kind of targeting these demographics, these populations of people. And if so, if you want to like plug them in the chat. But I think, yeah, I think we should really, I think the first step is knowing who's most at risk and knowing how. And then from there, you know, like doing our research. And I think right now doing research is kind of easier just because everything has gone online, that if you just like Google, I feel is a lot more specific now that we have moved basically completely digital. So something I want to really emphasize again is safety above everything. I know we talk about this a lot, and you've probably heard it a lot, seen it a lot. But I think it's still really important to revisit it because I don't think you can be too safe. So I think when we're doing this kind of work, and you know, we're either going to be distributing resources, or we're going to be in a situation where we have to be like out of our house and around people, even if you're 6 feet apart, there's still measures that need to be taken to make sure that you're safe and you're keeping others safe. You know, so like closely monitoring your health is one. Always wearing a mask, always, always, always wearing a mask. And using gloves only when necessary. I did a lot of research on gloves, and you actually don't need to use gloves unless you're directly caring for an ill person. And the reason for this is because there is I think people have this false security with gloves because they aren't aware of how easy it is to cross-contaminate, which really just makes it more dangerous for you, and kind of puts you in a position where you're more likely to get sick. And there are guidelines for using gloves from the Center for Disease Control and the World Health Organization. And I think when you're doing this kind of work, you really need to have a safety protocol, and you have to really revise it and keep it up to date, so that you are keeping people as safe as possible. And lastly, you know, just communicating with people, not assuming that people are as healthy as you, and assuming that people can take as many risks as you, and adjusting to folks' needs and really just social distancing. So I'm going to I have a PDF of these slides that I'm going to share with y'all in the chat shortly. And everything that's like brown and underlined that you've been seeing throughout the PowerPoint is a permalink. And so these are all permalinks that I thought were very useful to my research. And I feel if you want to go out and start, you know, doing some mutual aid work, it would also be really helpful to you. So I'm going to include that and pass it on to y'all very shortly. But now now that I kind of talked at y'all for so long, I really want to have a conversation now. So I'm going to stop sharing